So before we discuss mechanism of action, we know that calcium plays very important role, as many of the medical and nursing students know about calcium ions, is that it is very important for bone formation. It plays very important role in blood clotting. Yes, blood clotting and muscle contraction. Yes, we have a video on physiology of muscle contraction. You can also we can check that video, muscle contraction, right? Okay, now we are going to discuss about the mechanism of action. Before that, we have to understand the basic physiology of the pacemaker cells in the heart and non-pacemaker cells, how they actually work. So let's discuss these things. So there are the channels on the pacemaker cells known as funny sodium channels, and whenever there is action potential, the sodium ions influx occurs. Sodium ions flow inside the cell, pacemaker cells, and make it more electropositive, or we can say less electronegative. As the cell cell environment becomes more and more positive, the voltage sensitive calcium channels are stimulated. Which leads to influx of calcium. And then what happens? We know that yes, the cell becomes more and more electropositive, which further stimulate the L-type calcium channels. Yes, ladies and gentlemen, this further stimulate L-type calcium channels, and then happens more and more calcium blast inside the cell, inside the pacemaker cell, we can say. So therefore making the cell more and more electropositive and generating, yes please, action potential in the pacemaker cells. We know that pacemaker cells are present in the sinoatrial node, SA node, and AV node. Now as the cell is becoming more and more electropositive, we can say shifting off this positive ions or action potential across the membrane occurs between the two types of cells. First is pacemaker cells and others are non-pacemaker cells through the gap junction. We know that cells are having gap junctions for exchange of different type of ions and substances. So as these ions or action potential is moving or shifted towards the non-pacemaker cells of the myocardium, we can say myocardial muscles, it is becoming more and more electropositive, which further we can say opens the voltage sensitive funny sodium channels. Actually I am using the word funny, but they are not funny, they are just sodium channels, and there is inflow of sodium ions inside the non-pacemaker cells, which further increases the cell we can say positivity. And as this occurs, we had already studied in the physiology of muscle contraction that whenever a skeletal muscle or smooth muscle is stimulated, the action potential shift to across the membrane, inside the membrane, and finally it reaches towards the T tubules. If you don't know about T tubules, you can check our video on physiology of muscle contraction. So now we know that T tubules are having sarcoplasmic reticulum around them, which are very excellent source of calcium. So after the stimulation of T tubules and release of calcium, now the further calcium, we can say voltage sensitive calcium channels also open up, which further increases blast of calcium inside the cell. Blast of calcium inside the cell. This makes non-pacemaker cells further more and more electropositive, and This calcium, as we know, binds on the actin and myosin, further helping in cross bridging of them and muscle contraction. Wow, muscle contraction occurs. So ladies and gentlemen, till now we had discussed that calcium is the king. Calcium is the king in functioning of physiology of pacemaker cells and non-pacemaker cells. So now it is very easy for you and me to understand basically what the calcium channel blockers will do. They will just block the calcium channels. Excellent. Calcium channels are blocked. Will the cell be able to become more electropositive? No. And will the pacemaker cells able to stimulate these non-pacemaker cells? Absolutely no. And can there be influx of calcium ions inside the both cells? No. So till now we had seen that how the understanding of basic physiology help to understand the concept of mechanism of, we can say, calcium channel blockers or drugs. So similarly on the walls of, we can say, blood vessels, we are having smooth muscle layer. This smooth muscle layer is known as tunica media. So the cells of tunica media for the purpose of vasoconstriction and vasodilation. I am repeating, for the purpose of vasodilation and vasoconstriction are dependent upon calcium inflow. Once again, the king, calcium inflow. This is the example of vascular cells present in the smooth muscle layer of the blood vessels. Ladies and gentlemen, now we are discussing about the vascular cell. So calcium will further bind with calmodulin. We know that calmodulin is very important. Then it will stimulate CAM kinase. Then it will stimulate MLCK. We had already discussed MLCK, CAM kinase in the video of muscle contraction. So briefly discussing MLCK, light chain kinase, will stimulate actin myosin cross bridging. Ultimately, actin myosin cross bridging will occur, which will cause muscle contraction. If we block these calcium channels, will this process occur? No. Will there be any cross bridging between actin and myosin? Absolutely no. So this muscle contraction will not occur, and the blood vessels diameter will further increase. What do you think that whenever we increase the diameter of the blood vessel, it is known as, yes please, vasodilation. And whenever the diameter of a blood vessel increases, the blood pressure falls according to the rules of the physics. So what do you think it will be helpful in what patient's case? So if we already discussed during the starting of the lecture in a funny manner, if a person's blood pressure is increasing or sustainably increasing and is hypertensive, it is quite useful drugs, absolutely drugs. These drugs are the initial, we can say, starting drugs for the use for the treatment of we can say hypertension. Basically the patients are started with calcium channel blockers. These calcium channel blockers, kindly note, are synthetic drugs which were invented in 1964. 1964 is the year of their invention, and they are responsible for blockage of calcium channel blockers, and 30 to 40% patients with hypertension are prescribed calcium channel blockers and, we can say, diuretic drugs. We had already a video on ACE inhibitors and loop diuretics. In that video we had already discussed that the patients with hypertensive, we can say, behavior or pattern, whom the BP is high or rising, we are prescribing them loop diuretics and calcium channel blockers. So in this way, not only calcium channel blockers are useful for the hypertensive patients, But if you we can say think about a moment that heart has to pump more, because the blood pressure is more, heart has to pump more and heart rate will increase. If we decrease BP, if we decrease blood pressure, myocardium layer obvious has to work less. Therefore it is also useful in case of, we can say, heart disorders, cardiac disorders, especially myocardial infarction, because these drugs will decrease workload on the myocardial layer. So students, we had discussed about the mechanism of the action, that by blocking the calcium channels in both pacemaker, non-pacemaker cells and vascular system, these drugs work.